Afternoon. I'm Jeff Birdwell, Director of the Huntsville-Madison County Emergency Management Agency. It is Wednesday, September 1st. On behalf of Mayor Tommy Battle, Mayor Paul Finley, Commission Chairman Dale Strong, Huntsville-area government, healthcare, and emergency response agencies, we bring you this community's response to COVID-19. Our speakers today will be Mr. Jeff Sams, CEO of Huntsville Hospital, and Craig Williams, Chief Communications Officer for the Huntsville City School System. At this point, I'll give the following current numbers. In the state of Alabama, there's 704,420 confirmed cases of COVID-19. In Madison County, 44,199, having resulted in 553 confirmed deaths. Current positivity rate for Madison County right now is 20.1%. At this point, we'll go to our first speaker, Mr. Jeff Sams from Huntsville Hospital.
Thank you, Jeff. I'll start with our numbers. This morning in the Huntsville's Madison County hospitals, we have 208 COVID-19 inpatients, and there are another 41 COVID inpatients at Crestwood Hospital, so 249 in Madison County. Together, there's 57 of those in the ICU and 34 on a ventilator. Those numbers have approximately doubled in the past month. In our health system, we have a total of 415 inpatients with 112 in the ICU and 60 on a ventilator. There's significant COVID volume at every one of our hospitals. 89% of our inpatients are unvaccinated, and it's a similar statistic for Crestwood. So 90% of the inpatients in the Madison County hospitals with COVID are unvaccinated. The average age of those inpatients is 56 years old. The youngest is 1, and the oldest is 94. We have, just to kind of hit the age ranges, there are 42 inpatients in the hospital under age 40. There are 79 people in their 40s and 50s. As we've said many times, this is no longer a hospital disease in the elderly. These are people in their 40s and 50s who are critically ill in our hospital. We have 10 children in the hospital right now with COVID. 2 of them are in our pediatric ICU. We have 6 COVID inpatients who are currently pregnant, and we have 2 who are postpartum who are in our ICU with COVID. I wanted to hit a point of emphasis with that. The American College of Obstetrics and Gynecology, all the professional organizations have emphasized how important vaccination is during pregnancy. The immune system is challenged during pregnancy, and it has hit some of those women hard. And some of those stories are absolutely tragic. I would please encourage you, if you're in that situation, if you have any hesitation, contact your doctor and talk to him about it. We know it's a very personal decision, but we want you to know there are people in that situation in our hospital. Please take that very seriously. And another sobering statistic, between our hospitals in Madison County and Crestwood, in the last 2 days, we have had 15 people die of COVID in Madison County. I wanted to emphasize how COVID impacts everyone's ability to access the healthcare system. At our Huntsville Hospital, we have not done inpatient elective surgery in a month. There are people who've had surgical procedures that are technically elective, but it's not that elective if it's you waiting a month to have it, and they've waited a month for their surgery, and we don't know when we're going to be able to do it. There's long waits in our ER. Our ICUs are full, and I have ICU rooms that are designed for 1 patient, have 2 patients in them. That's because of COVID. So if you come to us and need an ICU room today, and you're not COVID, you're going to wait, because some people chose to not get vaccinated, and they're sitting in our ICU taking up a bed. Our staff are exhausted, mentally and physically. We're probably short 500 nurses right now to meet the demands. I want to take a moment and give my sincere, heartfelt thanks to the doctors and nurses in our hospital, the therapists, the support staff who continue to step up. There are long ER waits. There are slower EMS response times. ICU patients are on regular nursing floors. The individual choices people are making not to get vaccinated are impacting everyone in our community. I want to tell you, there's nothing political in these comments. I think we need to try to take the divide out of the discussions over COVID and vaccination. This is coming from your friends and neighbors who are taking care of their friends and neighbors in our hospital. We have to get past letting COVID and vaccination divide us. Everyone needs to be doing something to help with this. A couple facts. COVID is awful. You don't want it. I've seen it on a daily basis for 2 years. You do not want to get COVID. The vaccine will keep you safe and out of the hospital. 90% of the people who are in the hospital are unvaccinated. It's simple. It has been given safely to several hundred million people. There's still over 100,000 people in Madison County who are eligible for the vaccine and haven't had it. We don't need a few people to get vaccinated. We need 70,000 people to go get vaccinated. It's time for everyone to get on with it. Please stop getting your medical information off social media. The world's best scientist did not miss something that you found on a Reddit thread. It is time to get vaccinated and put this behind us. The only other comment I'll make, we always say this, if you are feeling sick and think you have symptoms, please don't wait. Please go get tested. The best therapy we have if you're COVID positive is the monoclonal antibodies, but they have to be given early. If you think you're sick, get tested and come get that treatment. It might keep you out of the hospital. And finally, with masks, I just want to tell everybody, masks are a very effective tool. They keep you safe. If you're in a crowd, if you're indoors, please wear a mask. It can protect you and your family. Thank you very much. And again, thanks to our staff and all the other healthcare providers.
Thank you, Jeff. Now we'll go to Mr. Craig Williams from Huntsville City School System.
Yes, good afternoon, gentlemen. Thank you all for having me as part of the panel. Long time, first time. Thank you all to media members and those in attendance. As I begin my remarks today, I'd really like to give a special shout out to the City of Huntsville, Mayor Tommy Battle, and the Mayor's Communications Department. I think these weekly briefings have really brought a lot of value to the community throughout the whole COVID pandemic. And as a communications professional, as a PR professional myself, I just want to say thank you for all the work you all have done in sharing this important information with the community. So here in Huntsville City Schools, we are marking nearly a month since the pandemic started, or not since the pandemic started, rather. We're marking a month since the first day of school. About that time period, the first day of school was on August 4th, and it's now September 1st, so we are coming up on 1 month since school has been in session. And just like last year, health and safety has remained the priority. We were one of the first districts in Alabama. To the best of my knowledge, I do believe we were the first school district in Alabama to announce a mask mandate to begin the school year. So that's something we followed through to fidelity, and that's something that we've seen a lot of other districts quickly follow suit on. So you look at a lot of the other large districts in the state, and they followed our lead there. And then you also look at some of the health protocols we have in place across our 40-plus campuses. We want to do everything we can to promote a safe and healthy environment, not only for students, but for staff members and families as well, because, of course, our students are going home at the end of the day, and they may be seeing elderly relatives and potentially vulnerable health populations. In taking a look at the case numbers, we are slightly down as of today. As you all know, we update our COVID dashboard every week here in Huntsville City Schools. That's something we update every Wednesday. And in taking a look at the numbers just a little while ago, we are at 249 as of September 1st, and that's 249 students and staff members combined out across the district, across our 40-plus schools, among more than 24,000 students who are out. So again, that's about 249. And taking a look at the numbers last week, as of August 25th, we were at 251. So we're holding steady right around that 250 number. And so again, we're very pleased to be holding steady in a district of more than 24,000 students and 40-plus campuses. So we certainly hope that remains the case. One thing I do want to take a minute here to address this afternoon is not only taking a moment to inform everybody of what's happening within the school system, but as part of my role, I also track a lot of things I hear across the school district and across the community. And I want to take a moment to address some misinformation that I've heard, kind of taking a trip to the rumor mill just to keep everybody on the same page. One thing I've received questions about is, hey, Craig, one thing we're hearing is that you all in Huntsville City Schools are preparing to go into remote learning district-wide based on your case numbers. And so based on where we are today in terms of case numbers, again, we're at right around 250 out of 24,000 students. So I want to be very clear and make sure I set the record straight today. We are not making any plans to transition as a school district into remote learning. That is simply not the case. I will say that remote learning is a resource that we have and resource that we are prepared to transition and utilize should conditions warrant. However, based on where we are today on September 1st, we're not in a place where we believe that we will be transitioning to remote learning. However, I will offer the disclaimer that one thing that we have seen throughout the pandemic is things can change and they can change very quickly. So we'll certainly continue to monitor the numbers not only this week, but throughout the school year. And finally, a message for parents. It's as simple as these gentlemen have stressed. If your child is sick, please don't send them to school. When we have so many students in every classroom, so many students in every building, I think one of the best ways to prevent COVID is making sure if your child is sick, please don't put them on a school bus. Please don't send them to a classroom among other kids where they could get other children sick. And finally, our goal here in Huntsville City Schools, we want to keep schools open while also making sure we do so as safely as possible. We want Huntsville City Schools to be an environment where students are safe, where teaching and learning is paramount, and where students have great academic success. And we want that to be the case all throughout the school year by promoting that safe and healthy environment. And that concludes my update. Thank you for your time.
Thank you, Mr. Williams. And thank you for watching today. Our next scheduled briefing is next Wednesday, September the 8th at 1 p.m. Until then, critical updates will be posted to the City of Huntsville's COVID-19 webpage, as well as the other websites of our partners here today. I would like to make a comment before we open it up to questions. The Labor Day holiday is coming up. We would like people to obviously follow the CDC's recommended guidelines for large gatherings, mask wearing, and all those guidelines. So until then, stay safe, stay separate, and remember to sanitize. So at this point, we'll take questions. Again, as you come to the mic, please identify yourself and who you're affiliated with, and we'll allow one question and a follow-up.
Hi, Olivia Schuler with Way 31 News. My question is for you, Jeff. We had seen that Alabama is going to get those, or hopefully get those additional 200 ventilators. Do you know yet how that's going to be distributed amongst the health system, or is it too early to say?
I don't know how those ventilators will be distributed. At this point in our health system, we are okay for ventilator equipment. We acquired extras during the initial surge, and we distribute them amongst our hospitals as need be. So as we stand here today, we really don't have any concerns about running out of ventilators in the health system.
Okay, thank you. And for a follow-up question, we had seen that Decatur Morgan Hospital had nurses working 60 hours a week, a lot more than what is considered normal. Is that a problem that you're seeing here at Huntsville Hospital, that nurses are working those extra hours like that?
I'd say that's a problem in every hospital in the country. We have 500 nurse vacancies right now. People are exhausted. So we pay our staff incentive pay. We offer them extra pay to pick up extra shifts. And many of them step up and they sacrifice their personal time and their family to come in and work these units. You have to have a certain skill set to be able to do this work. So we have been doing that throughout the pandemic. You know, we've begun to get back to something resembling normal when things dip down, and that's been part of the reason the Delta surge has been so challenged. You had people who had just gotten a breather, and they're all being asked to do extra again. And basically, they are working as much as they'll possibly be willing to work. That's the only way we're keeping it going.
Okay, thank you.
Yes, ma'am.
Hey y'all, Ayanna Willoughby, Fox 54. So my question is for Jeff. How are your hospitals preparing for Labor Day weekend?
So how are we? I guess we're preparing for Labor Day like we do anything else. We have our normal surge plans. We'll have our ERs available. I think our message for Labor Day is more to the community to have people make smart choices about the activities you engage in. I think it's possible to have fun in a socially distanced, responsible manner. Go outside, do something that is less likely to be a COVID event. There's lots of ways to have a good time without giving each other COVID. So we encourage everybody to have a wonderful Labor Day, but our message would be more about the community. We'll be here and ready to do what we need to do.
And my follow-up, the Alabama Hospital Association announced that they're doing a moment of silence next week for the victims of COVID-19. Are you encouraging your staff to participate in this?
Yeah, we will encourage them. We have a routine prayer service with our staff in the hospital. We do now, and we'll encourage all of our hospitals to participate in that moment of silence. I think it's a wonderful idea.
Thank you.
Rory Turner, 48 News. My question is for you, Jeff. With Labor Day coming up, obviously, there's a big possibility there could be another surge in COVID with people going out and celebrating with their family and their friends. What would you have in place if it gets to the point where there's so many people there that the hospital beds are just completely gone, and it gets to the point where you don't have any, you still have people coming in with COVID?
Yeah, our limited resource right now is not physical space, it's staff. The next phase for us would be to have to cancel more of the elective things we do. So we would have to pull more staff from other areas. Some of the day surgery we do, our physician office visits, we would have to repurpose staff who are doing other things to deal with COVID. So that's the next step in the surge plan. It's really not a matter of physical space right now. It's a matter of the human resource and the workforce to meet the demand. So we do have plans for that. We're just hoping we don't have to go there.
Brian Lawson, News 19. Mr. Sams, you talked about being down 500 nurses. What does that look like day to day? What does that look like from a management standpoint? What does it look like from a nurses on the floor standpoint?
So it means every day I've got nurse managers who are trying to make their schedule work. So they've got holes in their schedule, and they're calling all their staff, asking them if they'll work extra. And they're moving, people who normally work days are being moved to nights. And people who might work 3 12-hours a shift a week are working 4 or 5 away from their family. And keep in mind, when you're doing this on a COVID unit where there's not only the physical demands, but you're doing that all day and then going home to your family. So that's what we're asking people to do. Unbelievable healthcare heroes in our nursing, and not just nursing, respiratory, plant operations, food services, kind of just trying to make the schedule work. And we make it work, but it's incredibly stressful, particularly when you're asking somebody to give up the job they normally signed up to do and do something else. People are willing to do that for a period of time. It's been 1.5 years. I got nurses who came on board to work in orthopedics, and they've never taken care of anything except a COVID patient. They're new graduates, they've been working for 2 years, and they've never done anything but COVID. They never got to do the thing they signed up for. So it's that constant nature of it is what gets exhausting. And that's our imploring the community to please, out of respect for those people, consider getting that vaccination that will put an end to this so we can all go back to normal.
I'm not sure how you address this, but if you're short 500 and you're talking about a problem that's constant in nature, and human beings are a finite resource for a lot of obvious reasons that you just described, you've implored the community in the starkest terms I can think of, and it's still not registering. What do you see down the road at this present rate?
I've stopped trying to predict. I have got to believe, I am an optimist at heart, so I believe we will achieve herd immunity where the population has some immunity to the virus enough to keep you out of the hospital. So the vaccine does not guarantee you won't get COVID, but it gives you a very high probability you're going to stay out of the hospital. So if we can get the vaccination rate up, people who have had prior infection are going to have some level of immunity. I think down the road we will hit a point where we have enough immunity to prevent hospitalizations and COVID becomes more routine. I believe that will happen. I'm not an epidemiologist. There is an excellent New York Times article today that talks about the cycle of the variants, where they tend to have a 2-month cycle and they're not quite sure why they go down. We're approaching the other side of that curve. So I don't know that they exactly know why, but I welcome that decline. So like I said, I'm an optimist, and I think at some point we're going to reach a level of immunity where we can kind of go back to normal. And COVID's never going to go away, but I do think it can kind of be moved to the background and become fairly routine.
Mr. Williams, you mentioned misinformation. Can you give us a look at your decision-making process? You said remote learning is an option, but that's not something that's imminent. Can you talk about what would make it go from the current system to where a given school or a given set of schools would go to a remote learning setting, at least for some time? Is there a number? Is there a percentage? What guides that?
Sure. Thanks for that question, Mr. Lawson. The question is, what guides the decision as far as a potential scenario where we may go into district-wide remote learning? One thing that we've seen throughout the pandemic is so much of this is, as you said, unpredictable. That's the perfect word for it. So much of it is so hard to track, and especially it's difficult for any of us to try to anticipate what could potentially happen. But that being said, that's why our team put in many long days, long nights over the summer to put in plans in place for this school year. So that being said, due to the unpredictable nature of COVID, there is no magic number, there is no magic percentage in which could put us in COVID-19 remote learning scenario. What we do in our district, we continue to rely on the advice of medical professionals and medical experts. In taking a look at our current case numbers and looking at our case numbers school by school, we address COVID scenarios on a case-by-case basis. Every student is different, every campus is different, every school is different. And so we really address each case on an individual basis. We assess and address on an individual basis. However, we are mindful of the numbers of the district at large, and we'll certainly continue to monitor those.
I'm sorry, you said there's no magic number. You said you rely on the guidance of health officials and experts. What are they telling you about a number that might be not sustainable in a regular classroom?
Sure. One thing we turn to in terms of data, we rely on a lot of data and best practices from the ADPH, the Alabama Department of Public Health. Last year, they published what they called the ADPH Back to School Toolkit, and this year they just call it something like ADPH Guidance for Schools. And that's a lot of the data we follow in terms of making decisions and best practices, and we certainly invite the public to go take a look at those.
Thank you.
All right, at this point, we'll finish the press conference. Thank you for coming.